diet is important for chronic disease. It's important for climate change, which is a separate thing we're going to talk about, to inform what Medicare and Medicaid is going to pay for. Because the people that need this sort of support the most, and the people that are most under-resourced in this country, rely heavily on Medicare and Medicaid. And nutrition services are not covered for a lot of the chronic diseases that they have.
Hey everyone, so you're wondering why you can't unmute yourself. That's because we wanted to make sure that we can start as quickly as possible. And towards the end of the meeting, we'll definitely have time for Q&A, and that's when we'll unmute folks who have questions. And just to make sure you're in the right place, this is the Allied Scholars webinar with Dr. Ali Saad and Dr. Faraz Harsini. I really appreciate that all of you were here a little before time. So we've got pretty much all our participants in the meeting. So let's just get started right away. As we go on, if you guys have any questions, please type them in the chat. And at the end, you can also ask your questions. So please utilize chat and as well as thinking of questions towards the end. We won't take Q&A during the session just so that it can flow in the most organic way as possible. And with that, let's get started. So we've got Dr. Ali Saad, who's a board certified, he's triple board certified. So it's rare to have a physician who's certified in one specialty. Dr. Saad is board certified in 3 specialties: neurology, stroke, and lifestyle medicine. He's been practicing medicine for 15 years. He was a professor at Brown University, and now he's a fellow in climate change and health policy, as well as an affiliate professor at the University of Colorado. He's also the co-chair of the neurology interest group at the American College of Lifestyle Medicine, and also co-leads the group on neurologists interested in climate and health. Dr. Faraz Harsini, many of you would know, is the founder and CEO of Allied Scholars, and Allied Scholars is a not-for-profit that goes on college campuses and educates students, faculty, and staff on the harmful effects of animal consumption, not only on animals, but also on the environment and on health. So with that, let's just get started. So I guess my first question is to Dr. Saad. And I guess I'm curious, why did you get interested in the climate and the health of the planet? I know a lot of folks who get interested in plant-based eating and veganism for the ethical reason for the animals. Sometimes they do it for the health, but this is the first time I've heard of a physician who decided to also study climate. And it's not just a superficial study, you're actually a fellow in a climate research institute. So
thank you for that. I completed a fellowship in climate change and health policy at the University of Colorado this past summer, and now I've stayed on with them as affiliate faculty. And I think it's a growing movement. Like many of my colleagues in climate and health, I think it came out of a personal and pre-existing interest in climate change and environmentalism. And just by reading medical journals, seeing stuff in the news, they're recognizing that climate change is really impacting people's health. And I just happened to move to Colorado from DC a couple of years ago. And a friend of mine I was just talking with her on the phone. We were catching up. She's an ER doctor. And she told me, hey, there's this, you're in Denver, there's this climate and health fellowship at the University of Colorado. I'm like, what? And so I looked into it, I applied, and I got in. And it was wonderful. It gave me all the information and data and personal connections I needed to learn about climate change's impact on health and know the right people. And it strengthened the connection between medicine and climate change for me. So now that I can speak on it with authority, and I feel like it really helped connect the two things that are most important in my life: my passion for environmentalism and medicine. And the specific connection that I found most interesting and most germane as a physician was the connection through diet and our food systems.
So when I look at both you and Dr. Harsini, what stands out to me is that you'll have both doctors, studied a lot, very smart, very intelligent, and you'll have both come to this conclusion that there's nothing more important in my life to change the food system, to fight for the climate, to fight for the animals, to fight for the environment. So I'm guessing there's a lot of urgency that I sense not only in your words, but also in your actions and your life choices. So can you talk a little bit more about this? Why do you feel this urgency? Why do you both feel this urgency?
So for me, I mean, my specialty is stroke and neurology. So most of the people I see in the hospital are stroke. And stroke is due to 10 major risk factors. And of those 10 risk factors, 6 are directly related to diet. When you take those 10 risk factors, they account for 90% of stroke. So a lot of people think stroke is this weird thing that happens due to genetics or bad luck, but it's mostly due to the same things that cause heart disease. And in treating my patients, I realized that I'm not really giving them the tools and the resources they need to make good choices and easy choices to reduce their stroke risk. And so I continue to see patients because there's a need, but I need to work on the policy side as well to make the cheap and the easy choice also the healthy choice. And really now when you look at the data, food has become the biggest modifiable, or diet has become the biggest modifiable risk factor for chronic disease and death, both in the US and globally. And I can share some slides on that. Let me pull this up. So right here, these are the top 10 causes of death in the world, according to the WHO. And the ones that are blue bars are called non-communicable diseases. They're related to lifestyle, the way you live your life, and the environmental exposures you have. And then you have the green diseases over here. There's 3 of them, and these are called communicable diseases, and they're basically infectious diseases. And you can see the difference between the white circle and the colored circle on all of these. Compare the mortality data or the deaths in the year 2000 compared to 2019. And you can see that for all these non-communicable diseases, they've all increased in the amount of death that they're causing, whereas the communicable diseases have all decreased. So that means things that are related to lifestyle are the things that are killing us right now. And it's important to have that perspective because for thousands of years, the things that were killing people were accidents, infections, wars. Those were the things that were mainly killing people. And so our public health systems were designed to address those things, to keep people safe, to keep people from getting infected, and to also keep them from dying from malnutrition. And so the Industrial Revolution was important in that it allowed us to produce both plant-based and animal-based foods at a very cheap and very fast rate. And so people were no longer dying of malnutrition in terms of not getting enough calories. But now we've kind of overcorrected. And so a lot of people are getting way too many calories, or they're getting food that is high in calories and low in nutrition. And our public health systems and our guidelines have not really had a chance to catch up with that.
That was a very interesting chart because, as you mentioned, throughout our history, we've been at the mercy of communicable diseases. We've been at the mercy of infectious diseases. We seem to have conquered that, but in its place, maybe something more insidious is happening where we directly are responsible for the harm we are causing ourselves. It's not something that's in the environment. It's something that we are deliberately choosing to ingest, to use, to produce. Dr. Harsini, anything you want to add? I know you work with pandemics, antibiotic resistance. You used to develop drugs for COVID and other infectious diseases.
Yeah, so my introduction to biomedical sciences was actually because I just really wanted to save people. And that started by cancer research because, I was a chemical engineer before and all you hear is like cancer, cancer, cancer. And I was like, I really want to do something about that. And throughout my cancer research, I saw that, 40% of cancers are preventable with lifestyle interventions. And then after my doctorate, I was working on developing new therapeutics, new antibodies for influenza, for COVID, for other inflammatory molecules that are involved in cancer, etc. And I was really tired of working on all these diseases that are caused by lifestyle choices. And the reason I'm dedicating my life to this today is because it's also neglected. So if I don't design drugs for influenza, there are tons of pharmaceutical companies that make a lot of money from doing that. So someone will do it. But how many people are actually talking about the root cause, which is the food that we eat? So let me share a slide here. So these are basically the comparisons between the different food systems from plant-based, cultivated meat, chicken, pork, and beef. And you can see in a lot of areas, whether it's land use, water use, air pollution, toxic chemicals, and greenhouse gas emissions, plant-based foods win every single time. And so just to give you one example, these are the lagoons, waste lagoons that you can find by factory farms. These are not isolated cases. You can just play a game and go on Google Maps, and especially in places like North Carolina, and you can actually see all these. And by the way, you can see the trees around the area, and then how much of it had to be cut down for these factory farms, and then the waste area nearby. And what happens a lot of times is also when there are floods, all these places literally go underwater. And what do you normally find in these wastes? It's a lot of antibiotics, because as you probably know, 70 to 80% of antibiotics are fed to animals. So this directly causes antibiotic resistance, which is one of the biggest threats to human life. And I think the way that we should be looking at diet is not just what we put in our mouth, but its impact on others as well. And so I was actually working on antibodies for influenza. And one reason I gave up was because as long as we're consuming eggs and chickens, we're going to have bird flu. And just last year, if you probably remember, the egg prices went up, and that's just because we got hit by another bird flu, H5N1. And this is from CDC and gets updated every Wednesday. You can go and look. And by now, it's about 60 million birds that were affected and had to be killed. And something that I always point out in this website is it's not just factory farm birds. It's backyard and locally raised birds, in addition to commercially raised animals. And the reason that I think this is so important is because, once we are hit by an antibiotic-resistant species and other forms of pandemics that are antibiotic resistant, this is going to be literally the end of modern medicine, because our antibiotics won't work anymore. And not enough people talk about this, right? So that's why it's very neglected, and it literally impacts every single human and animal on this planet. So that's one reason I think this is an urgency.
I'd like to show one more slide actually from the CDC, since most of our audience is US based. So let me pull this up. And I think a lot of people aren't really aware of how bad our rate of chronic disease is. So here's chronic disease data in the US from the CDC. 6 in 10 Americans have at least one chronic disease, and 4 in 10 have at least two. And it costs $4.1 trillion a year. That's 20% or almost 20% of the gross domestic product for the US. And these are the chronic diseases we're talking about. And with the exception of chronic lung disease, which is mostly due to smoking, all of these have a huge part related to diet. These are the 4 risk factors that cause these chronic diseases. And again, with the exception of chronic lung disease, poor nutrition is heavily involved with all of these. And as I mentioned earlier, stroke, 90% of it is totally preventable. A lot of it from diet, the same as heart disease. And it's interesting for us, you mentioned cancer. and um, modifiable risk. The same can be said about dementia. Dementia is anywhere from 40 to 60% preventable. And people think, again, dementia is like this thing where it runs in your family and it's bad luck, which, it can be. But for the cases where dementia is totally genetic and no matter what you do, you're for sure going to get it, that is 1% of cases. Most cases of dementia are modifiable and largely preventable. And so let me show you this other screen over here. So this is from my colleagues, Dr. Zine and Aisha Shirzai. They're neurologists also working in lifestyle medicine. And here, 40 to 60% of cases of dementia can be prevented through these things. Some of them are diet, but some of them are other things. People are looking for these magic pills or magic foods to have to reduce their risk of dementia. And there isn't really one thing. Dementia is caused by so many things, not only what you eat, but how far do you get in school? Are you giving yourself challenges that are challenging without being frustrating? So you're working your brain at all stages in life. It's your exposure to air pollution. It's hearing loss. It's head injuries. It's drinking too much alcohol, depression, poor social connection. It's all of these things. And so all of these lifestyle risk factors end up affecting this complicated disease of dementia. And I kind of think of the brain similar to the planet, and that it's not one thing that determines the health of the planet. It's so many things. And I love food when it comes to climate change in our food systems, because it's not simply a matter of carbon accounting where we say, like, these are the greenhouse gas emissions from ruminants and the greenhouse gas emissions from cutting down the trees. Greenhouse gases are a big part of the climate impact from foods, but it's also the health of our soil, the impact on tree canopy, and the impact on biodiversity and water use and infectious disease on humans. Diet is so, it's got its fingers throughout climate change. Because when you look at the global greenhouse gases, most of them are from the energy sector. So like about 60, 70% are related to industry, energy, transportation, but that remaining quarter to third of greenhouse gases are from our food systems.
So now that both of you have explained how urgent this issue is. So I'm curious, so you're a physician and I'm guessing you see patients. So if this is so important, is there something else that you're doing besides educating your patients about it?
Yeah, so I see patients, depending on the month, anywhere from 10 to 14 days a month. I'll see patients in the hospital as well as via telemedicine. But the rest of the time, I'm doing work aimed at changing public policy. Because here's the problem when you're talking about most chronic diseases, but I'll use stroke as an example. You come to the hospital with a stroke because you've had a lifetime of injuries to your body, leading to high blood pressure, diabetes, high cholesterol, obesity, and these things over time damage your blood vessels and eventually lead to a stroke. So you come into the hospital, and the hospital is credentialed if they meet certain metrics. So they have to make sure that they give you a blood thinner, they check your cholesterol, they evaluate you for emergency treatments, they have a physical therapist see you. There's a bunch of boxes they have to tick. But there is no box related to diet. There is no law, there is no credential that a hospital has to meet in terms of what they feed you, and then also what resources they give you upon discharge. So really what happens is you get emergency treatment in the hospital to maybe reduce the severity of your stroke or to stop the stroke that you're having, but then you're sent back out into the community without the resources you need. It's basically, here's a fact sheet on healthy eating. Good luck, make better choices. And if you don't have the resources to get a nutritionist on your own, your Medicare and Medicaid is not going to pay for a nutrition consult because it's not a covered diagnosis. Stroke is not a covered diagnosis. And so are many chronic diseases. And so what I'm trying to show my fellow physicians is we've got all this chronic disease. The top two chronic diseases in the US and the world are heart disease and stroke. They kill the most people and they lead to the most disability. And they're largely modifiable. And one of the main ways we can modify them is what we feed people. And so if we are not addressing food security and nutrition education, both in the hospital and upon discharge into the community, we're doing a disservice to our patients. And so hospital behavior is not going to change unless there are guidelines that hospitals have to adhere to regarding diet, and doctors' education about diet, which is minimal in medical school, is not going to change unless there are medical society guidelines, like you go to the American Heart Association or the American Academy of Neurology. They have to have guidelines saying nutrition is important for these diseases, therefore it should be taught in medical school. And this is what should be taught in medical schools, but that's absent. So if medical schools don't have their credentials hanging on being able to meet the guidelines in terms of what they need to teach their students, if hospitals don't have their credentialing tied to what they're giving their patients in terms of diet, then behaviors on the parts of physicians and hospitals are not going to change. And ultimately, we need physicians to say, diet is important for chronic disease. It's important for climate change, which is a separate thing we're going to talk about, to inform what Medicare and Medicaid is going to pay for. Because the people that need this sort of support the most, and the people that are most under-resourced in this country, rely heavily on Medicare and Medicaid. And nutrition services are not covered for a lot of the chronic diseases that they have.
So it sounds like you're a doctor who's educating other doctors on the nutritional impacts of the diseases that they're treating.
Right. And then for the doctors that do happen to care about climate change or are curious about climate change, I tell them, hey, here are all these co-benefits to planetary health that you are going to implement, even if you are a climate denier, even if you care about climate change, but you don't want to do anything about it. All the things that you are doing for your patients regarding our food systems have all these co-benefits for climate change, and you are being a climate advocate without even being aware of it. And it's really important to frame it about the patient, about healthcare, because that is the priority, and that's our main focus as physicians, right? It's about the patient, it's about keeping the population healthy. And I think climate change and planetary health is something we need to keep in the back of our minds and address and with the policies that we are advocating for. But we can't go to patients and we can't go to fellow physicians and say, hey, we need to fix climate change if it's not through the lens of health equity.
Got it. So it sounds like diet, besides the health aspect, which we'll talk about, does have an impact on climate change. And what would those be, real quick? The impact of diet on planetary health?
So the impact of diet on planetary health, let me pull up a slide, because like I was saying, it's so much more than just the carbon footprint. Let's see here.
I just wanted to quickly point out how ridiculous it is that in this country, being healthy puts you in minority, given the fact that majority of people have at least one chronic disease.
Mm-hmm. No, absolutely. So here are the environmental impacts. I think this is really summed up nicely from our world in data. So like I was saying, about a quarter of our greenhouse gases come from our food system, and the non-food here is transportation and energy. This inflates to about a third food when you include food waste. But then also you look at our land use. 50% of the world's habitable land, that means not deserts, not the Arctic tundra, where we can actually live, is to grow our food. And it's really basic thermodynamics, right? If you're growing a bunch of plants, you can either eat them directly or you can feed them to an animal, then eat the animal. And it's a lot less efficient to feed it to the animal, right? Same with our fresh water. Most of it goes towards agriculture, and most of that agriculture water goes directly to cows or to the crops that will then feed cows, for cows and other ruminants. And then agriculture also accounts for eutrophication. So eutrophication is when you take healthy water, whether you're talking about the ocean or fresh water, and you introduce a lot of waste into it. So you think of that picture that Faraz showed of those lagoons. Those lagoons are basically manure and urine and carcasses and all this waste that comes from these CAFOs, these concentrated animal feeding operations or factory farms. And these large animals, like cows, produce so much waste, and there's really nowhere to put it. And so they put it in these lagoons. And there's a couple of ways they dispose of it. They dispose of it by just putting it into our fresh waters or our oceans, or they actually spray it and put it into sprinklers and spray it into surrounding crops. And so what happens is the bacteria in that, as well as the nitrogen and phosphorus in the waste, will end up in the water. And those things will kill healthy organisms in the water. And they will promote the growth of algae. And so algae becomes out of control. And the algae grows, it eats up all the oxygen in the water. And then you can't have plants surviving in the water, and you can't have animals surviving in the water. So it's killing marine life. There's also the issue of mammal biodiversity. So most of the mammals on the planet are livestock. It's not simply a matter of feeling good about ourselves that, there are a diverse, number of species that we can, go and look at in nature. It's also a matter of food security and a matter of infectious disease safety. Because if you've got a lot of a single kind of animal, and that particular species of animal, like take chickens, for example, if you're producing a lot of chickens and those chickens are not biodiverse, they're all coming from the same hen, that means that if you get a virus and it's infecting those chickens, there's not a lot of genetic diversity in those chickens, and they're all tightly packed together in a factory farm. That means that virus is going to spread very easily. That infection is going to spread very easily, and it's going to basically be a petri dish for mutations, because you just have more bodies for that virus to mutate in. And that's how we end up getting a lot of these zoonotic diseases. Because you think about the zoonotic diseases we've had over the last few decades, we're not getting cat flu and dog flu and elephant flu. We're getting swine flu. We're getting bird flu. We're getting things that are originating in animals that we are treating poorly, packing together tightly, and basically creating these large petri dishes for very virulent viruses and drug-resistant bacteria to form.
That's a great insight. I never thought about why we're getting swine flu or avian flu and not elephant flu. And like you point out, it's obvious, right? That it's because we're associating so much more with certain types of animals, putting them in cramped environments. That's why it's becoming the vector for infectious diseases. So let's switch from climate to the health. What are the benefits of a plant-based diet? And this is especially important because you're a physician, so you know how the body works, you treat patients. What do we get when we eat plants and not eat animals?
I'm already unmuted. Okay, great. So the thing is, when I'm talking to physicians and patients, I don't really have to find isolated studies to show, like, did you know this reduces your risk of heart attack? And here is the study from the New England Journal of Medicine. It's already in our guidelines. So let me pull this up. And it's in mainstream guidelines. So I'll show here a picture from a very recent paper. It's called Food as Medicine from the American Heart Association. It's a presidential advisory. And let me see what happened to, I'm not able to share my screen anymore. Not getting that option. Oh no, here it is. My mistake. So here, you look at this table in the top left corner, and it says evidence-based diet guidelines to promote cardiovascular health. You look down here at number 4, mostly protein from plants. This is straight from the American Heart Association, guys. This is not some like weird fringe guideline. They're saying most of your protein should be from plants. And then you look at the other portions and it says use liquid plant oils, eat plenty of fruits and veggies, etc. Basically eat a lot of plants. But most specifically, your proteins should be coming largely from plants. You want to have animal products for your, health-wise, that's fine, but it should not make up the majority of your calories. And this is just one guideline. There are several major bodies that are now incorporating the statement that most of your protein should be coming from plants. And I can show some more pictures about mortality. Let me find a good one that I like. Here, mortality. And the way I like to frame it to people is, the messaging is really important, that because, people know that bad food is bad for them, right? You don't need to tell them that. The way I like to frame it is, let's have you eat more of these good foods, because you can only eat so much in a day, right? And the more good, healthy foods you put on your plate, the more of the bad foods you naturally displace. So it's an indirect way of doing it. So this graph over here, is it full screen?
Yes.
Okay, great. So this shows us mortality by dietary type. So the dietary types that are at the top of the list are the ones that kill the most. And you can see here the things that kill the most are diet high in sodium, which is a good surrogate marker for ultra-processed foods. And the way I like to explain ultra-processed foods, versus minimally processed foods are something is usually ultra-processed if you look at it and you can't really recognize the ingredients pretty readily, or it comes in a box or a can and you look at the back and you don't recognize most of the ingredients, or it's a ton of ingredients, it's probably ultra-processed. And it tends to have a lot of added sugar, salt, and fat to it. So these ultra-processed foods are what's killing us. But look at the other things that are killing us. Diets low in whole grains, diets low in fruit, diets low in nuts and seeds, diets low in veggies. And so this is what I like to tell people. You need to eat more of these things because they're good for you. And by doing this, they're going to naturally displace the other stuff, like foods high in saturated fat and low in fiber, like meat, like dairy, like fish. So that's how I like to frame it, that, you're not eating enough of the food that's good for you. Let's get you there.
Ali, I think there is also a problem that, yes, people know bad food is bad for them, but when they think about bad food, they may think about sausage and bacon. Mm-hmm. But something that amazes me is that when you think about smoking, the second thing that you think about is lung cancer. But still, when people think about red meat, or even like a hamburger, what they're thinking about is like a good source of protein, a nutritious food, which I think is problematic.
Yeah. And actually that reminds me of this. So have a look at this. Differences in all-cause mortality for major protein sources. And so the reference they use is dairy. So dairy is 0. So everything higher than dairy is associated with more death compared to dairy, and everything lower than the line is associated with less death compared to dairy. So fish and chicken are, a little bit lower than dairy, but plants are the lowest over here. And so, when we're talking about animal products, some are less healthy than others. And so what I'm always trying to get people off of, the number one thing, is processed meat, processed red meat specifically. And the WHO categorizes processed red meat as a class 1 carcinogen. That's in the same category as cigarettes and as x-rays. This is something that is definitely a cause of cancer. It's not even a debate. And then they categorize unprocessed red meat as a probable cause of cancer. So my number one thing is to get them off of red meat. And if they can, they're starting to substitute their red meat with chicken and dairy, that's better than red meat. But ultimately what I want them to do is get most of their protein from plant sources.
Very interesting. So we talked about climate, we talked about health, and what I hear from Dr. Harsini is that you were interested in the climate, but you were not yet fully plant-based, and then something shifted. What happened?
Yeah, so I've always been wanting to eat healthy my whole life. And even after having done medical school and residency and fellowship, I didn't really learn anything special about diet. I'll tell you the extent of my dietary education during medical school. What they taught us was, these are the fat-soluble vitamins, and these are the water-soluble vitamins. Memorize them for your test. That's all I remember about nutrition from medical school. And so I had to read.
And just to have a reference, when you say your medical career, so it's how many years in medical school?
So 4 years in medical school, 3 years in residency, and 1 year in my stroke fellowship.
So that's 8 years of education, and the sum total can be explained in a few sentences.
Pretty much. And we all took for granted that, yes, diet is super important, but no one really explained what is a healthy diet? How do you quantify it, right? And what's the actual data behind it? It's just eat healthy. I don't know, have a salad, add it to whatever you're eating. You'll be fine. That was the message. So the reason I was, I progressively eat, healthier, and I was eating more plant-based is because of the dietary data I saw. And I think compared to when I decided to become an ethical vegan a few years ago, the minimal amount of animal products I was consuming was good from a personal and planetary health perspective. But what made me become an ethical vegan is watching my octopus teacher. because prior to Octopus Teacher, I watched the very graphic.
What is Octopus Teacher?
My Octopus Teacher.
Is it a YouTube channel? Is it a song? I don't know what it is.
It's a documentary on Netflix.
Got
and
it.
It's about this guy that basically goes to the ocean every day, and he swims with this octopus every day and just hangs out with them. And he just watches the octopus's behavior. And it's funny that even after watching all these very graphic documentaries and YouTube videos of horrible things happening to animals and factory farms, it's the Octopus Teacher that changed my mind. And I always think back to that when I'm talking to people, whenever I'm trying to convince them about anything, not even related to diet or climate change. It's just framing something as very positive and showing the benefits of something rather than showing the horribleness of a situation. It tends to engage people a lot more. And so after watching My Octopus Teacher, at that point, I was eating fish sometimes and seafood. But I'd taken everything else out of my diet. And I thought, you know what, here are my values. Here's what I'm doing. There's a mismatch. Fish can't scream and they can't grimace the way, other animals can, but that doesn't mean they're not suffering. And so I really need to align my values with my actions. And once I decided to become a ethical vegan, there was really no backtracking, because from a human or planetary health perspective, it was permissible to eat some animal products, but as an ethical vegan, it wasn't. And it forced me to overcome one of, I guess, my major barrier to becoming fully vegan prior to that was eating food that had enough calories and that tasted good. And so it forced me to learn how to cook. Because if I wasn't cooking, I was eating out and eating food that was really bad for me or that just didn't taste good. And once I learned how to cook, that was overcoming a huge hurdle for me, because now I could make delicious food that was nutritious. And I didn't really have a barrier. I wasn't losing weight anymore. I wasn't getting bored with my food. And that was my, watching My Octopus Teacher was the inspiration. And then learning how to cook was the logistical barrier that I overcame.
I just want to say very quick, regarding what you mentioned before as well, I just want to really encourage everyone on this call to please take care of yourself. I know a lot of you guys are vegan, and a lot of times what we eat is, Oreos and French fries and Beyond Burger. And I mean, there are studies showing that if you replace red meat with, hamburger with Beyond Burger, that there are health benefits. But really, compared to a whole food plant-based diet and something healthy, all I'm just saying is please take care of yourself. You guys are going to have really important careers, and it's a disservice to yourself and to the world when you don't take care of yourself. So think about that. Another thing about My Octopus Teacher, when it came out, I was working in a pharmaceutical company, and one of my colleagues came to me and said, Faraz, you love animals, right? And I was like, oh, no. I knew where it was going, because I know that, to people, it's like, if you're vegan, you must just be in love with cows and chickens, which I never forget that, because really, to me, the point is not to love animals. I don't think you need to love all animals in order to realize hurting them is wrong. But yeah.
So don't eat junk food is what the doctors are telling us. And just moving on from that topic, since we've just got 20 minutes left, since we've got doctors in the room, one of the most common questions literally every vegan is asked is, where you're going to get your protein, and you're just going to waste away and die. So please reassure us.
Yeah. So the picture of veganism for a lot of people is, eating a bunch of fruits and veggies, which is part of it. But eating a diet that is mainly just fruits and veggies is not a healthy diet. You need to have protein. And, the people freaking out about protein is, I think, actually justified. Not in terms of, veganism specifically, but just getting enough protein, because our bodies can make fat and our bodies can make carbs, but our bodies cannot make protein without taking in amino acids. You need to have protein externally. Whether you take in protein, fat, or carbohydrates, ultimately your body converts it to glucose or sugar, and that's your energy source. And so you can be on a carb-free diet, you can be on a fat-free diet, but you can't be on a protein-free diet. It's just not doable. So we need protein. But we don't need as much protein as we think we do. So the average person needs about 50 to 60 grams of protein, which is not a lot. People are, they're trying to consume like 100 grams, and it's 50 to 60 is actually the recommended amount, and you can get that. And what I like to explain to my patients is legumes and beans and lentils and nuts, they are the meat of the plant kingdom, because they provide us not only with the protein but the iron that we need. And it's also got fiber in it, which is satiating. And so we look at all the blue zones around the world. So there are 5 blue zones, and these are zones where people are living past 100 more frequently than other parts of the world. But they're not just living past 100, they're living past 100 and they're functional and independent members of society. They're not sitting at home disabled. They are working, they are playing with their grandchildren, they're living their lives, basically. And what these blue zones have in common is none of them are vegan. One of them is vegetarian, but all of them are plant-based or plant-forward, where most of their food is coming from plants. And they all have some kind of bean or legume as a core component of their diets, whether it's black beans, soybeans, whatever it is. They all have these legumes because this is where they're getting their protein and their iron, and it's contributing to their longevity. Beans are so important. And actually, let me show you this one bean diagram. Where is it? My bean thing. I'll find it in a sec. But it's one of the things that we are totally under consuming worldwide. I'll find it later. I can bring it up later.
I'll just say I did my entire doctorate studying protein structure and function. And really, if I want to put what proteins are in a simple word, think about Lego. And when you use certain number of Lego pieces to make different tools, proteins are just tools for your body to do things. And your body has to make all these proteins themselves, right? So when you eat protein from a cow, from a goat, all happens is that your body digests that protein to the tiny pieces, the building blocks, just like those Lego parts, and you make your own proteins. And there are only 20 amino acids, and only half of them, or actually 9 of them, are essential that you have to get them from your diet. And originally, all of them come from plants anyways. It's virtually impossible to get enough calories and not get enough proteins. Like the only people who have to worry about that, there probably are people who have to worry about that in the world, but those are not like us.
By us, and people in the United States, right?
Yeah. Majority of people in the US at least get more protein that they need. And just remember this, any organism that has a cell, it has to have proteins and it has to have all 20 amino acids. So if you are eating something that, any plant, literally all plants have all 20 amino acids. And I just really want to clarify this. There is a definition which is complete protein, which I think is a very bad definition because it gives people this idea that other forms of proteins are not complete. Even with that bad definition, soy is still a complete protein. But all it means is that you should have the essential amino acids, or those that you have to get from your diet. It should have them in certain ratios. And literally the only way not to get enough of these amino acids is like if you ate only rice and nothing else. And I don't know anyone who eats like that. So but it gives people this idea that plants don't have complete proteins, which is just false.
Right. Plants are actually better sources of protein because, at least my understanding is, that they don't come with the saturated fat, they don't come with the cholesterol, they don't come with the toxins, and they don't potentially come with external animal hormones, right?
Right. And the way I like to explain it to patients is you don't need certain foods, you need certain nutrients, and the food we eat is a package for that nutrient. So, people are always or, a lot of doctors always recommending you have to have fish, you have to have fish. You don't need to have fish, you need to have omega-3s. And the fish don't make these omega-3s, right? The fish eat seaweed and algae, and they get those omega-3s. We can do the same thing by eating seaweed and algae, but a lot of people can, they might find that gross. It's not their cup of tea. And so you can also get your omega-3s from eating nuts and seeds. And so you can just bypass the fish and eat what the fish are eating, because when you have the fish, not only are you getting the omega-3s, but you are getting the bad fats, you're getting the saturated fat. So a single serving of wild-caught salmon has 40% of your daily allowance of saturated fat. That's not something we talk about. We talk about the omega-3s a lot, but not saturated fat. The fish also has no fiber. The fish also has heavy metals. And so you can bypass all those things by going straight to what the fish is eating. And I really like what, Faraz, what you said about we need the nutrients, and are you able to see this food plate from Canada?
Yes.
Okay, so Canada is way ahead of the US. Just like the US, they issue dietary guidelines every few years. And rather than a food pyramid, they now have a plate. The US also has a plate. It's called My Plate. But this is the Canadian version. So this is their most recent iteration of their guidelines. I think it was from 2020. It's pretty recent. But here's how they divide their plate. They should say half of it should be healthy fruits and veggies, a quarter should be whole grains, and a quarter should be protein. They don't say you need to have meat and dairy. They say you should have protein. Meat and dairy are ways of getting protein. And you have eggs and chicken and salmon there. But look, you've also got tofu. You've also got these beans. You've also got nuts. And this is a much more inclusive way to tell people to eat protein. And it's a more accurate way to tell people to eat protein. It's telling them you need protein. And when you look in the details of their guidelines, like many other guidelines, they say these are your protein options. Most of your protein should be coming from plants for the following reasons, because you get fiber and you get less saturated fat, etc. And when you contrast this to the US's My Plate, the US has a side plate on the side that says milk or dairy. I forget which it is, but it's dairy basically. So dairy is still an included food group. And this is a problem because you think about populations at risk who get most of their food from the government, and that maybe they're incarcerated. Maybe they go to a public school. They're in some kind of situation where the government is subsidizing the food they're eating. And that food is going to be whatever the government determines to be healthy food, right? And that's going to come from the government's My Plate, or they're basically what the food pyramid used to be. And if milk is a compulsory component, that means if you are incarcerated, you go into a public school, you're going to get a glass of milk or some kind of dairy product as part of your complete meal, because that's what's been determined per the guidelines to be a complete meal. And the problem with that is it's discriminatory, because most people in the world are lactose intolerant. And so if you're telling people we are only going to give you, we have to give you dairy, and that's going to be your source of calcium or your source of protein or whatever it is in this meal, and it's not something that you are able to digest appropriately, that's discriminatory.
Very good. So as we come to the end of the hour, let's wrap up, since we have students from lots of different universities. We've got students from MIT, Columbia, Cornell, lots of universities in Texas, and where we have Allied Scholars chapters. So what options exist for students who, like Dr. Harsini and like yourself, want to make an impact on these issues?
So I would say starting at when you're a student, there are organizations that work with universities that use something called nudge theory. So there's this one nonprofit called Greener by Default. And what they do is they provide free consultations by looking at a university cafeteria's menu, or like a hospital systems menu or whatever. And they'll say, okay, we are not going to label things as vegan or plant-based. We're just going to say, beans and rice. And they don't put these labels on things that are going to maybe turn people off. And they also make whatever is plant-rich and plant-forward the featured dish. And so when someone looks at the menu, they'll say, this is the dish of the day. And it happens to be a dish that is plant-based. And a lot of people will just get that because it's what's in their face. It's the immediately available option. But at the same time, if they look at the menu and they see all these options, they say, I don't want the thing that's featured. I want a burger. They're entitled to do that, and they can order a burger or whatever animal-based product they want. It's just not what's forward-facing, and that's nudge theory. So it's preserving people's autonomy and ability to make choices, but it's pushing them in the direction of making healthier choices. So I think that's a great organization, that ASAP can connect you guys with. But that's just one example. There are lots of organizations out there.
So I just want to say that no matter what you guys decide to do with your careers, there is something for you to do. And one reason, so I was just in American College of Lifestyle Medicine conference, and what I saw was most people there, where they're in their 50s and 60s, some of them had done 2 or 3 residencies before they came across plant-based diet. And that just says to me that the educational system is broken. And that's why we want to really bring this education to people as early as we possibly can. And I want people to go to medical school, to go to law school with this in mind, that the food system is what they want to change, instead of them ending up in medical school and accidentally coming across the impact of the food we eat on the environment. So whether you go to law school, vet school, politics, work as scientists on alternative proteins, whatever your major is, you can do something. I want to show you something really quick on a few recent news articles.
And then after you show that, Faraz, I want to show a Venn diagram I really like, but please go ahead.
Perfect. So scientists can work in the lab to show different things, such as climate. And eventually what really makes a difference is when these articles make it to mainstream media. So this is from Science. And just imagine the number of people who read this. And this is the work done by a lot of scientists, a lot of people who wanted to put this out there, and also by the person in Science magazine who decided to write about this. So you could be a writer or into media or whatever and make an impact this way. So Denmark, for the first time, is designing a roadmap for a plant-based country. So imagine the number of politicians and lawyers and other people who behind the scenes are pushing for these plans. As you know, at Columbia University, ASAP is running a campaign which is 100% plant-based university, and that's in collaboration with plant-based universities in the UK. This is a letter with over 600 scientists who signed this, that in order to do something about the climate, we need plant-based universities. And a couple of universities in the UK have already committed to this. So these kind of campaigns are run purely by students like yourself. This is New York City. If you didn't know, all the public hospitals in New York City now serve 100% plant-based meals by default. So if somebody doesn't want plant-based food, they have to ask for it. And funny enough, their key for pushing this plan was actually climate and reducing greenhouse gases. Then you had a Dutch city that basically banned advertisement for meat. But that was only one city. But today you can actually see more than one city that is basically banning meat and dairy in public spaces. You have other programs such as increasing the tax for red meat. So this is, for instance, a study they did in the UK that how much money they can actually save by increasing the taxes for red meat. So it can be either tax for the health impact of red meat or climate, both. So these are just examples to show you how much power there is when you actually put what you do into the bigger picture. And something that I really loved about Dr. Saad is, he's not just seeing patients like many other physicians, but also working on policies, because that's where we make the big impact. Go ahead, Eddie.
No, thank you. And I'm not going to share my screen. I think you covered it, but what I'd like to relay is there are so many ways that you can have an impact, but you have to leverage what you're good at. Like, don't just look at the data and be like, this is what needs the most work. Even if that needs the most work, if it's not your forte, it may not be the best use of your time. You want to do something where you can make an impact, leveraging your talents, doing something you enjoy. And you've got to be able to recognize, okay, I'm talking to this person, I'm talking to this organization. What are their values? What do they care about? Because what I've learned in talking to different kinds of people in different sectors over the last few years is we don't have to believe the same thing. Our beliefs don't have to be aligned. Our actions have to be aligned. So if we can get to the same place for different reasons, that's fine. So you might, if I'm talking to a conservative politician, for example, and I won't necessarily even say climate change when I'm talking about climate and health. I'll say there's pollution in your city. Here's data on pollution in your city and how it's impacting your population. The air quality, the water quality, the contaminants in the water and air. And this is the health outcomes that we are getting for our constituents. They'll say, oh, that's terrible. And I haven't even brought up climate change. I'm talking about dirty air and water. Nobody wants dirty air and water. And so that's one way to frame it. If you're talking to a hospital, hospitals are businesses, and finger wagging about the right thing to do is not going to be an effective tool. What you need to do is say, here are the risks from climate change, for example, and look at what happened in the city when there was a hurricane. Look at what happened to the city when there was a heat wave. This infrastructure got destroyed, and the hospital lost a lot of money from the canceled surgeries it had. And so in order for your health system to be financially resilient, you've got to be climate resilient. And so that's a language that'll speak to them. So you've got to figure out, what do people care about, and you basically use that language. So you can ultimately get to the same and common goal, but it's aligned with their values.
Just before we move on to Q&A, just want to say very quick, I see a lot of students on this call, and just want to say how much I appreciate every single one of you. I see a lot of brain power here. And all I just want to say is, please don't underestimate the power that all of you can have as an individual. I mean, you already have. I know how much you do in your own universities, but thank you for being here. Thank you for seeing that there is a problem and for doing something about it.
Yeah. And what I would add is that don't feel that you have to get into a career that's going to be 100% advocating for veganism or plant-based. I'd love it if you did, but I also know that coming out of college, those type of positions are not available for everyone who wants it. But I would jump up what Dr. Saad said, which is figure out what you're good at, what your skills are. And it doesn't matter what you're good at. Everyone is going to be good at something. And as you go about your life, keep talking about veganism, keep talking about plant-based diets, because the more you talk about it, the more it will stick in someone's head and the more likely it is to change. Because if you don't talk about what you believe in, why should others believe in that? So that would be my suggestion, that keep talking, keep pushing, keep fighting, retreat when you have to, get up and then fight some more. And with that, let's do Q&A. So if there are any questions, please type them in the chat and we will address them. Okay, Joey's got a question, and then let's go to the one in the chat. And also you can raise your hand on Zoom and we'll give you the video and the... Okay, so let's see if I can figure out how to do this.
Hi, can you hear me? Yeah.
Yep, hear you and see you.
I just have a question for Dr. Saad. Thanks for the presentation, first of all. I was wondering, if your values with respect to climate change and ethical veganism, does that kind of motivate you to promote plant-based diets to your patients more than you otherwise might based on just the evidence alone? Do you push for that more because you have these other values, or is that something that you find undesirable? And if so, how do you avoid that, I guess?
So I just want to make sure I understand your question correctly. Is it about the concern of mixing my professional duties with my personal values?
Yeah, basically, do you ever feel pushed to use your job in your clinical practice as a vehicle for activism, essentially, for these other issues that maybe aren't related to the to the health?
Yeah. Yeah, so I definitely use my job to push for activism, but it's always with the focus of, because what's my duty as a doctor? My duty is to prevent and treat disease, right? And so, yes, I'm also an ethical vegan. Yes, I also care about climate change, but the solutions and the advocacy that I come up with are synergistic, where it's always about the patient, it's always about their health, and so telling them, I'm encouraging you to have a plant-based diet, not because it's a personal belief I have, it's because this is what our medical guidelines recommend. And here are the guidelines. And I know that it's important for the specific health conditions you have. And for people that do have a personal stake, like I see someone come into the clinic and they have a t-shirt that says divest from fossil fuels, for example, we can get into that. And I can talk about the climate aspect because it appeals to their values. But I always want to make sure that the patient's health is front and center, because that's why they're coming to see me. And I do incorporate things like ethical veganism for the sake of the animals, or food as it relates to climate change, if it's relevant to the patient and it's something that they volunteer.
Great.
And the same goes with working for organizations. Sorry.
Sure. Let's move to one of the text questions, and then we'll come back to you, Leo. I see your hand raised. So there's a question that says, for those of us that want to incorporate diet to health outcomes in our research, do you have a recommendation of where to find data? Databases available on food choices leading to health and disease outcomes?
Yeah, so I can think of a couple of things. One really easily accessible one where you can get graphs and charts is Our World in Data. It's got data on just about anything you can imagine. So that's one. Another one is this organization called the Physicians Committee for Responsible Medicine. And on their website, you can find fact sheets specific to certain diseases and certain conditions, and they'll provide you references and data on, diet as it relates to those specific diseases. That's another one. Those are the two that come off the top of my head. Faraz, do you have any that you'd recommend?
Yeah, PCRM is what I was thinking also. They do have a handbook for nutrition and medicine as well. It's a large handbook. There's an app actually that you can download that PCRM has put together. So definitely check that out.
Yeah, the app is great. It's you can, if you have a newer Mac, you can also just use it on your Mac, just like your phone. Nifty.
I got Our World in Data, but I didn't hear the second one. I was trying to write it down.
Oh, it's Physicians Committee for Responsible Medicine, PCRM.
Thank you.
Sure.
Okay, let's move to Leo since you've had your hand up.
Yeah, so there's been a lot of scrutiny around the nutritional value of plant-based meats like Beyond Meat. So I was wondering, as a physician, what your opinion is on Beyond Meat and what role plant-based meats could play in the nutrition transition and the epidemiological transition.
Okay, so from a climate change perspective, these meat substitutes are amazing. They use much less resources and are way better for the planet. From a personal health perspective, I still think of them as junk food. They are marginally better than a conventional burger, but what I like to show patients when they ask questions about Beyond Meat or Impossible Burgers or anything like that is I'll just go on the computer and pull up the nutrition label on Google, and I'll compare that to a burger. You can just go to a Nutrition Facts website where they basically pull up those back of the box nutrition facts, and I'll show them, look, here's the saturated fat. Here is the fact that there's no fiber. Here are the fact that there are a ton of ingredients. Here's the fact that there's a lot of salt. And so it's not really good for you, but I do see it as a transition food where I'll say, someone like really craves burgers, and it's an important emotional food for them. It's a way for them to see that they can eat food that tastes, the way they want things to taste without necessarily coming from animals. So I think it's a good transition food, but if someone were to eat meat substitutes like Beyond Burgers as a staple in their diet long term, I would not advise that.
Got it. Okay, let's go to one of the text questions. Can you recommend any research on plant-based iron sources for people who have iron absorption issues?
I would say go to nutritionfacts.org. And then in the search bar, you can just type in iron. and that would probably be a good place to go. They have a lot of nitty gritty data on specific micronutrients, including iron.
I'll just add something about iron. I love this topic. So there are two types of iron, heme iron, which is found in meat, and then non-heme iron, which is found in meat and also plants. Plants only have non-heme iron. Your body, if you are depleted from iron, your rate of absorption automatically goes up with non-heme iron. Heme iron is absorbed faster. Its bioavailability is higher for sure, but that's not always good. But also the other thing that most people don't know is that when you cook meat, heme iron and not non-heme iron precipitates. And that doesn't happen with non-heme iron. So when you cook plants, you don't get rid of iron. In fact, there is something called phytates that bind to iron and make them less available in plants. Actually, when you soak beans, when you cook plants, you get rid of phytate, you make non-heme iron more available. And the opposite happens. When you cook meat, the heme iron actually precipitates. And they did a study, and I believe it was somewhere between like 70 to 75% of iron in non-vegans actually come from plants and cereals and other fortified food. What it basically says is that even a lot of non-vegans still get most of their iron from plant sources.
Yeah. So soak your beans. And with that, let's go to Joey. He's got his hand up.
Hey, just another question for Dr. Saad. You mentioned like how all the nutrition guidelines, they already kind of align with the mostly plant-based diet. I'm wondering what you feel the disconnect is between that and like your patients and the general public being motivated to switch to a plant-based diet. Because it seems like, even though it seems like a lot of people know that plant-based diets are healthier and things like that, you feel like, what needs to happen for them to actually start switching?
Yeah. So even though the guidelines, like major medical society guidelines, are very gradually creeping towards eating mostly plant-based or already say eat plant-based, the disconnect is that it's not made it into medical school education. So doctors don't really know. That's one thing. So they're not communicating it to their patients. Number two, it's not in hospital guidelines. So hospitals aren't, these guidelines are just advice, but they are not mandated. So they don't have to follow these guidelines. So it's not made it into credentialing metrics for hospitals. And it's also not made itself into insurance reimbursements. So the diet is not really a big component of the kinds of services that are reimbursable through Medicare and Medicaid. Like when you go to a doctor and if they feel like you'd benefit from a nutritionist, a lot of the time, if you don't have certain diseases, you would have to pay out of pocket for a nutritionist and it would be super expensive. So that's one thing. And then the other thing is, even though the data is pretty clear, we know that people don't make decisions based on rationality and data, right? People make emotional decisions. And we're not just talking about certain kinds of people. It's in any profession and in any country and in any group, people make emotional decisions. And so you think about someone gets up and they're having a stressful day. How are they going to cope with stress? They might have a stress food, and that stress food is going to be whatever their parents gave them when they were stressed when they were a kid. And so they're going to eat that. They're going to, if someone is not financially secure, they're going to go to whatever food is cheapest. And that may not be the healthiest food, right? You think about what's super cheap and easily accessible. A $1 burger from McDonald's, super cheap and accessible. Not healthy, right? It's going to be a lot more effort and a lot more money and probably some cooking involved to go and get something that's better for you. People also don't learn how to cook, right? So you graduate from college, you start making your own salary, and has anyone taught you how to cook? Right? Or has anyone taught you how to cook well? You might cook something and be like, oh, this is terrible. And you just end up ordering out. So there are a lot of barriers as to why people can't or don't eat healthy, even though the data supports it.
Let's go to Ryan. He's got his hand up.
Hi, you able to hear me okay?
Yes.
Yes.
Awesome. Yeah, thank you for the really wonderful presentation, all the work you do. I was regarding one of the comments you made, how like hospitals are set up like a business. would you say the solution to getting more plant-based options or education in regards to hospitals for plant-based nutrition is to work within the system of them already being a business and try to show that it's an incentive for them? Or do you think there has to be a structural change in the economics of how hospital works in order to achieve that outcome of plant-based nutrition in hospitals?
Yeah, I think it's all the above. So you need the carrot and the stick. The carrot is if you have a constituency, like you can show that a lot of the employees or the people in the community care about this and they want to please the community and get that business and have them go to their hospital rather than the hospital next door. That's the carrot. The stick is when you go to a hospital, they'll usually have some big certificate in the lobby and say like, we are, a certified stroke center or a certified whatever center. In order to maintain that certification, they need to tick certain boxes, and nutrition is not currently on there. And so once nutrition makes it into that certification process, that becomes the stick, because if they're not meeting those nutrition metrics, they're going to lose their certification. And so you really need both, and you do have to treat it like a business. Absolutely.
Cool. Okay, I'm going to address one question in the comments, and then we'll go to another question. So Clementine and Julian are saying that if we label food in the dining hall and we take away the vegan labels, they're going to be scared eating the foods. And I think what was being suggested by Greener by Default and the nudging is that we know that the vegans will seek out the vegan food and there will be some labeling for vegans. But instead of calling something vegan meatballs, we can just call them meatballs and spaghetti, and that would get the non-vegans eating those products. Because as soon as we put vegan in front of it, most of the non-vegans will not eat it. And to illustrate this, Faraz and I were at Columbia University, where they're 50% vegetarian and vegan. And the guy in front of us was lining up to have the meatballs and spaghetti that in the fine print was labeled as plant-based. So we asked him, so are you vegan? And he said, what do you mean, are you vegan? So we said, well, those meatballs are vegan. And he's like, oh, I didn't know, but I really love them because they taste good. So at the end of the day, people just care about taste and convenience. So for the non-vegans, to get them to embrace veganism and plant-based food, we've got to do this type of nudging or making it the default. But very definitely for the vegans and the plant-based, there will always be options that are labeled that way. So it's not that we're removing those labels entirely. We have 15 minutes over, so I want to get to another question. And if you guys have a few more questions, feel free to type it in. It's from Leo. He's saying, how much protein would you recommend for athletes trying to build muscle mass? I've heard rules like 1 gram per pound of body weight, but I wonder if this is overkill.
No, I mean, that's about right, because the average person needs about 0.8. So if you're bodybuilding, it's about 1 gram. The amount of recommended protein also varies, even if you're not bodybuilding, by age, if you happen to be pregnant, if you're breastfeeding, it also varies. But 0.8 is kind of the average when you lump all these groups together, and more or less depending on your situation. But yeah, 1 gram is reasonable.
Yeah, Ryan says that there's no benefit. He's linked to a study from NIH that says there's no benefit when you go past 1.6 grams per kilo for athletes. So if that is 1.6 grams per kilo, it equates to around, if you convert it to the 1 gram per pound, it would be around 0.8, 0.9, right? So it's around 1 or less. Any other questions that we haven't covered? If not, well, thank you very much for joining us. We enjoyed having you on board. And as always, as Faraz said, we're extremely proud and inspired by the work you guys do on campuses. And if there's anything we can ever do to help support you, answer questions, provide resources, just let us know.
Thanks, everybody.
Thank you and good night.